Hello audience, my name is Trish Murphy with the Orlando Medical News, and I'm here today with Dr. Brady of Radiology Specialist of Florida at Florida Hospital. And today we're going to be talking about colorectal cancer. So let's start with a very basic definition. What exactly is colorectal cancer?
So colorectal cancer, it's the third most common cause of cancer in men and women in the United States. So a colon cancer is it's an abnormal growth of cells or a tumor that occurs in the colon or the rectum, which is the last part of the digestive tract. So the colon itself is about 5 feet in length or about 150 centimeters, and the rectum is the very last part of the colon, and it's about 6 inches in length or about 15 centimeters. So any cancer that occurs in this part of the digestive tract is a colorectal cancer.
How does colorectal cancer start?
So almost every colorectal cancer starts as a small polyp. So it's a small growth that starts on the inside lining of the colon, and then so over time, if these things go unchecked, they can grow and they can develop into a full-blown cancer.
So tell me, who is at risk for a colorectal cancer?
There's a lot of different risk factors. So probably the biggest risk factor is age. Most cases of colon cancer occur in patients over the age of 50. So that's the first risk factor. There's other risk factors. If you smoke, excessive alcohol consumption, eating a lot of red meat or certain kinds of processed meats, and those things can increase your risk for colon cancer. Patients with diabetes, if you have an inactive lifestyle, those sorts of things also place you at risk. Some patients have a strong family history of colon cancer. So say you had a close relative who had colon cancer, that's gonna put you at increased risk. Some people also have inflammatory conditions of their bowels, so things like ulcerative colitis or Crohn's disease, which are risk factors. There's some rare genetic predispositions that can highly increase your risk as well. So things like Lynch syndrome, there's another one called familial adenomatous polyposis. And then there's even certain ethnic and racial groups that are at increased risk, such as African Americans and Jews of Eastern European descent. So those are some of the risk factors.
Gotcha. So it sounds like there are some we can prevent. It's lifestyle connected, and other ones just simply out of our hands.
Right, definitely.
What is the radiologist's role in screening for colorectal cancer?
So like we mentioned, so most people are going to start screening for colon cancer at the age of 50. If you have a strong family history, or if you have one of these other conditions that places you at increased risk, then you may want to talk with your doctor about screening, like starting even before the age of 50. But for most people, it's going to be at the age of 50.
Dr. Brady, what is the radiologist's role in screening for colorectal cancer?
Okay. So as we discussed, so in most cases, you're going to want to start screening for colon cancer at the age of 50. In certain patient subsets, so say you have a strong family history of colon cancer, or you have one of these other conditions that predisposes you or puts you at higher risk for colon cancer, then you may want to talk with your doctor about starting screening even before the age of 50. But in most cases, it's going to start at the age of 50. So the best modalities we have today to be able to visualize polyps are optical colonoscopy, which is your traditional colonoscopy performed by the gastroenterologist, and then on the radiologist side, we also have what's called virtual colonoscopy.
Wow, that's interesting. Tell me more about the virtual colonoscopy.
Okay, so for virtual colonoscopy, so the preparation is going to be pretty similar to what you would do for a traditional or standard colonoscopy. So several days before, you're going to start drinking clear liquids. You're going to be on a low residue, low fiber diet. And then the day before the exam, you're going to take some laxatives, which are going to help to clear out the colon. And then also in radiology, we have some tagging agents, we call them. So it's some contrast that you drink, and then it'll label if there's any leftover stool or liquid in the colon. It'll tag that. So then when we go back and review the images, we'll be able to differentiate a polyp from some leftover stool or other material there. So then the day of the colonoscopy, the virtual colonoscopy, so you'll come over to the to the CT scanner room. We'll put you on the table, laying down, and then we'll insert a small flexible tube into the rectum, and then we'll fill the colon with either air or carbon dioxide. And then so getting good distension is going to allow us to get really good pictures of the inside of the colon.
Right.
And then so once we've done that, once we put the air or the carbon dioxide in the colon, we'll run you through the CT scanner. Usually we'll do that in a couple of different positions. So usually one of them you'll be lying on your back, and then the other one will either have you lay on your stomach or on your right or left side. And then so once we've done that, so we'll review the images on a workstation. So we'll look at them in the conventional two-dimensional way, but then also we have advanced software that can actually create three-dimensional images of the colon.
Wow.
So it's almost as if you were going through the colon with a camera, and it gives you really good resolution, and you're able to detect polyps. So, and a lot of studies have been done that show that virtual colonoscopy is comparable to optical colonoscopy in detecting polyps.
Okay. So Dr. Brady, in what ways is the radiologist involved in the care of a patient who's been diagnosed with colorectal cancer?
So once a patient's been diagnosed with colon cancer, they're typically going to undergo a staging evaluation. So what we're trying to figure out is if the colon or the rectal cancer, if it's confined to the colon or the rectum, or if it's spread beyond, so say to lymph nodes or to other organs. So the patients will typically undergo CT scans of their chest, their abdomen, their pelvis. Almost every patient who has rectal cancer is going to get an MRI of the rectum to see if it's spread beyond the wall of the rectum and to the lymph nodes. We can also do other imaging studies such as a PET CT, where we use some radionuclides to try and localize tumors anywhere in the body. And then so once patients are treated for colon cancer or rectal cancer, they do follow-up studies to see if the patients are having a response to the treatment. And so based on what that shows, they can decide to try something else or to continue with what they're doing. And then sometimes as we're working up these patients, we may find say a mass in the liver, and we're not sure if it's a cancer or if it's a benign tumor. So as radiologists, we can also do biopsies. So typically what we'll do is we'll sedate the patient, and then we'll advance a needle just directly through the skin and into the mass, and we can get some samples of that to get a diagnosis. And so those are all sorts of things on the diagnostic end, but there's also some things we can do on the therapeutic end as well.
Mm-hmm.
So one of those, there's a procedure called ablation. So in patients some patients who have, say, limited, maybe one or only a couple of lesions in the liver, what we can do is we can, usually under anesthesia, we can advance a probe through the skin directly into the mass in the liver, and then using heat energy, we can burn the tumors and kill the tumor cells.
Wow.
And then one other option in some patients who have more advanced colorectal cancer, so say they have more extensive disease in the liver, and they can advance a very small catheter. They go up into one of the arteries in the liver, and they can actually deliver localized radiation therapy to a confined portion of the liver, and that can shrink the tumors and can kill some of the tumors.
So Dr. Brady, how closely do you work with other doctors in the care of patients with colorectal cancer?
All right, so here at Florida Hospital, so what we do is every week we have these multidisciplinary tumor boards, they're called. So we get together, so it's the radiologists, it's the colorectal surgeons, it's the radiation oncologists, it's the medical oncologists. So everyone gets together, we review all the imaging studies on patients with newly diagnosed cancers or patients who have been treated for cancer. And then as a team, we come up with a plan to optimize the treatment for each individual patient.
Excellent. So the radiologist really plays a distinct role in patient care.
Right.
Great. Thank you for watching today. And remember, Radiology Specialists of Florida with the trusted Florida Hospital brand, quality imaging and diagnostic starts today.